End-of-life care is for patients with terminal illnesses or life-limiting illnesses who are in the final stages of their life. The person who can make the determination of if the patient is nearing his or her end of life is the medical oncologist. The oncologist can speak with the patient about the patient's prognosis, and then the care team in the oncology department, such as the social worker, is also happy to meet with the patient and the family to understand what the patient's goals are and goals of care are in relation to that prognosis. When we think of end-of-life care, sometimes people also think of hospice care. And hospice is a program and a type of care that we offer to patients who are nearing the end of their life. It's a philosophy of care, and it isn't necessarily a place. Hospice can be delivered and offered in a patient's home, wherever they call home. It can be a private residence, it can be in an assisted living facility, or in a skilled nursing facility. And hospice is a program that's provided by a care team of doctors and nurses and social workers and chaplains, volunteers and certified nursing assistants. And these individuals are a separate group from the medical oncology department. Studies show that when patients receive hospice care in their home and they're having the support of all the disciplines coming together in an environment that's familiar to them, individuals can live longer and with a higher quality of life. To access hospice care, a patient or a family member could speak with a medical oncologist, and the oncologist can work with the social worker to make a referral to a hospice organization that's located near the patient's home. And hospice care is covered by most insurance companies. Part of the criteria for being eligible for the program is if the medical oncologist determines that if the patient's disease continues to progress at a natural rate that it is at that current time, the patient's life expectancy is most likely 6 months or less. Something that patients and family members might not know about hospice care is that the family member is really doing the majority of the care for the patient if they're at home, and the facility staff is doing the majority of care for the patient if the patient is living in an assisted living facility or a skilled nursing facility. And hospice is really available to supplement that care. Hospice nurses usually visit a patient about once or twice a week for about an hour. Certified nursing assistants provide care to patients 2 or 3 times a week for about an hour and a half, and social workers and chaplains typically visit with patients and family members about once or twice a month, so it is not 24-hour care. But the nurses at hospice really do a thorough job to educate the family members who are providing the majority of the caregiving for the patient, so that the caregivers and the family members do feel very supported in that new role that they have adopted. Hospice is available 24 hours a day, 7 days a week, to have an extra support system if needed. So if a family member or a patient has a question, there's always a nurse or a social worker or a chaplain available to speak with that patient or family member over the phone. And if that's not enough, then that discipline can go out and do a visit with the family member or the patient as well.